Okay. Okay guys, today we're going to talk about the first joint of our upper limb, which one that the middle end of the clavicle is making the manubrum of the sternum. So this joint here and here, the cut portion that we can see on the right side, left side it is intact. So this joint is actually the synovial joint. It is a kind of the saddle joint which can perform the movement in the anterior posterior, a little bit vertical and a little bit in the rotation portion. This joint is supported by the ligaments. Anteriorly, we got here the sternal clavicle ligament, and the posteriorly the same name, the posterior sternal clavicular ligament. The third ligament that is between the two clavicle and passing superior to this portion here, to the superior jugular notch or sternal notch. This place here, this ligament is going from one clavicle to another, so we call that interclavicular ligament. So the fourth ligament that is helping to support this joint, that is coming from the first costal portion, so we call that costoclavicular ligament. Mostly this is supplied by the internal thoracic artery branches and also the suprascapular artery branches. It is innervated from the supraclavicular or suprascapular nerve. Thank you very much. The acromioclavicular joint, which is made by the lateral end of the clavicle and the acromion process of the scapula. This joint is a synovial joint, and this is the plane joint, and it is also performing some movement in the anterior posterior vertical axis and also in the rotational to some extent in the limited portion. So this is surrounded by the joint capsule. This joint is downside is supported by the ligament coming from the coracoid process. We call that acromioclavicular ligament. This acromioclavicular ligament is having the two part, trapezoid part and the conoid part. And here joint capsule is having the acromioclavicular ligament anteriorly and posteriorly. Some people also present as the superior and inferior ligament. Okay, so this joint is supplied from the suprascapular artery and the suprascapular or supraclavicular nerve. Thank you very much.
And talk about the glenohumeral joint, inoid cavity of scapula. It is a structure of scapula, and the other structure is the head of the humerus. It is a ball and socket joint and a synovial joint. It can perform the movement as flexion and extension, abduction and adduction movement, medial rotation, lateral rotation, and circumduction. Now we will look at the next specimen, in which we can see the rotator cuff, the four rotator cuff tendons. Those are giving the reinforce to this joint. Anterior view, let's move in this way. In the anterior view, we can see the tendon of the subscapularis muscle, which is attaching at the subscapular fossa to the lesser tubercle of the humerus. And the other three tendons we can see from the posteriorly at the greater tubercle. We can see here the tendon of the supraspinatus, which is attaching at the greater tubercle, and another tendon we can see here, that is the infraspinatus muscle. The last tendon we can see here, that is the muscle which is originating from the lateral border of the scapula, and it is attaching also on the greater tubercle. These four tendons giving the reinforce and making the curve around this joint, and they can reinforce anteriorly, superiorly and posteriorly to this joint. We can also see here the tendon of the long head of the bicep is passing through into this cavity. Now we will look at the next specimen. You can see that the capsule is intact, and we can also see the bicep tendon is also intact there. We open the capsule and then we can see the is a thin capsule outside the fibrous, and the inner we are having the synovial membrane, as we can see here. We can open and look inside the accessory structure of this joint. We got here the glenoid labrum, which is a fiber cartilaginous ring around the glenoid fossa, which is helping it to get more deepen and fix the head of the humerus there. Glenoid labrum is just making this more deeper and stabilize this joint. And the next specimen, we can see here the accessory ligaments of this joint, or we can say extracapsular ligaments. We can see here. Yeah, we can see here the crocoid process, and we can see above the clavicle attached with it. We can see above the clavicle, and from the back side we can see the acromion. We can now look at the ligament. This is the acromioclavicular ligament. In the acromioclavicular joint we had talked about it. Now we are looking at the this joint protection superiorly. That is the coracoacromial ligament that is reinforcing superiorly. We can see anteriorly we got here the coracohumeral ligament. We can also see acromioclavicular ligament. You can see here the glenohumeral ligament anterior view. We got here the superior glenohumeral ligament, middle glenohumeral ligament, and inferior glenohumeral ligament. In our lab specimen, actually this one is torn away already, okay, and not very much clear, so I try to put it in this way in it. Thank you.